So we are going to finish quotes today, guys. This is it. This is the very end. This is the end. My only... No, you won't know that song. That's not a song. Okay. Infertility is unable to become pregnant after a year of trying, or inability to maintain a pregnancy till actual birth. So I know that at this stage of your life, we try to drill into you that like sometimes you make eye contact from across the room for too long and you get pregnant. And that's true. I mean, it's not, but you get my point. But there are a lot of couples, in fact, you can see over here, especially as you begin to get older, that deal with infertility issues that can't get pregnant. So, again, numbers depend on age. So like 10% of just the general population, everyone. 1 out of 7 couples, 30 to 34, then 1 out of 5. And then you'll see once you're 40, like 25% of people struggle to get pregnant or again, to stay pregnant. So this is the getting pregnant part. This is the staying pregnant. So sometimes these women don't have problems conceiving, but then they have spontaneous abortions, meaning not went somewhere and had an abortion, but their body just decided to abort the fetus. And we will also call that infertility. So there's lots of different things that can cause it. Anything that damages the fallopian tubes in a woman. So whether that's pelvic inflammatory disease or just structurally how she was built. Because remember that that's where fertilization occurs, and that if the sperm can't get to the egg in that fallopian tube, then you're going to have a problem. Or if the sperm gets to the egg and can't get out, you're going to have an ectopic pregnancy. In men, there's one thing. So there's a million things that can happen to females that cause infertility. In men, it is a sperm problem. So it's either low sperm count, meaning that they don't make enough, or low sperm mobility. So they might make plenty, but none of them are good swimmers. And so they all die before they can reach the egg. In a woman, again, hormonal imbalance. Some of the disorders that we've discussed would be pelvic inflammatory disease, causes those structural problems with the fallopian tube. Polycystic ovarian syndrome causes the hormonal imbalances. That's one of the number one causes of infertility in America. There are a ton of them. So here are the treatment options for couples who are struggling. One of the first things that we'll do, first of all, the man just gets tested, gets a sperm count. So he goes to a doctor, ejaculates into a cup, they test his sperm count. But for women, they will almost like inject at a high velocity this dye sort of stuff into up into the uterus to clear out the fallopian tubes. So it'll clear out any little cobwebby scar tissue, like from PID, or sometimes the endometriosis that has caused problems. Or we can do artificial insemination, which is where they take a concentrated dose of sperm. So lots and lots and lots of sperm in the ejaculate fluid, and they either put it into the woman's uterus or the fallopian tubes via a catheter, that little tube that they thread up in there. Women can also be on fertility drugs. Fertility drugs, usually the thought behind them is to increase how many eggs they ovulate. So like if you've ever heard of John and Kate plus 8 or any of those things where people have had, 4, 5, 6 kids at once in one pregnancy, that's almost always because they were on a fertility drug. So the scary part of that is that, if you ovulate 8 eggs instead of the normal 1, you do have more likelihood that you're going to get pregnant, but you also have the chance that you could have 8. That you could get pregnant with 8 fetuses. And then generally at that point, they will ask you to decide which ones to terminate, because we're not built like puppies. Like dogs, we can't hold multiple litters well. And so in order to let some of them really grow and thrive, they will elect to terminate, to kill some of the fetuses so that the others will have enough room. There's also something called in vitro, which you probably heard of. In vitro, so artificial insemination is where they just inject sperm into you. In vitro is actually where we take out an egg from the mom and we take out sperm from the dad. We fertilize it in a lab, let it make a zygote, let it make that precursor to a baby, and then we place it back in the uterus, cross our fingers, and hope it will attach. So we absolutely fertilize it. The thing we can't make happen for sure is the attachment, is that it will actually implant in the uterus. but still this is a much higher likelihood than this. Cool. Here you go. So you take egg out, you combine egg with sperm in petri dish, you let grow a little, and then you put in and hope that it takes hold. That's actual photo of them inseminating an egg. That's like, this is science making a baby right here. There should be like Barry White playing in the background. This is incredible. They're making a human in that picture. There's another form of this, and I don't want you to get too caught up in it, but there's another form of this where they do this exact same thing, but instead of putting it in the uterus, they put it up in the fallopian tube to kind of more mimic the natural, give it a few days to grow and then implant type of thing. So contraception. Contra means goes against, and ception like conception, so making a baby. So things that go against baby making. I'm going to say this very loudly, but don't cover your ears because you need to hear it. Abstinence is the only way to be sure you do not get pregnant. Anyone need me to repeat it? I'll repeat it. The only way that you can be 100% sure that you are not going to get pregnant is to not have sex. And even that didn't work for Mary, but some other options. So sterilization. Remember we talked about sterilizing a man. Man meant he didn't have enough sperm to likely be able to conceive or to make a baby. So for a female, the surgery, you've probably heard it called getting your tubes tied. The fancy name for it is tubal ligation. So tubes and ligation meaning like cut off, secured, tied. So this is, the tubes are the fallopian tubes. So they make they cut and tie the fallopian tubes, because then even though you're making an egg and releasing it, it can't go anywhere. So the sperm can never get to the egg because there's a huge surgical roadblock in the way. Next is something we call barrier methods. These are far more common in men than women, but we're still going to talk about them. So there is a version of a condom that is a female condom that the woman inserts into her instead of what we usually think of as condoms that the man puts on the penis. So this is a artistic representation of a female condom. Spermicides, a lot of the barrier methods you're going to have spermicides added to them. So these are like foams or gels or things that you can think of it like an antibiotic to bacteria. It is something that kills the sperm. So it decreases the number of sperm that are going to successfully get into you, which will decrease the likelihood of getting pregnant. Diaphragm is another thing. Let's see if I have a picture. I do. So this little white cuppy thing, looks like a little hat, is a diaphragm. The female inserts it intravaginally, and it's like a little cup that stays right there. So again, then if the penis were to ejaculate sperm into here, it can't get past here. And a lot of times these diaphragms are also impregnated with, meaning have on them spermicides. A little bit different is something called the cervical cap and the contraceptive sponge. So again, cervical caps are just like different shapes, and they can stay in for a little bit of a different time versus the diaphragm. Contraceptive sponge, again, kind of just like a little bit of a different shape. The sponge is a one and done, so you throw these away. The diaphragms and the cervical caps are reusable. And the sponge is, again, almost always impregnated with, meaning has in it the spermicides. Most common form of female contraception is hormonal female contraception. So that's generally what we're going to think of as birth control. So females who take birth control in any form, the pill, the rod, the implant, whatever it is that you have, has either estrogen or progesterone, or some of them will have just progesterone. So basically the point here is that the estrogen and the progesterone kind of puppeteer, they control your body's hormones so that your body never releases FSH to grow the egg and LH to ovulate the egg. So if we can control estrogen, progesterone, then we basically in effect stop the growing and release of an ova, of an egg from the female ovary. And again, if there's no egg, then you can't make a baby. That's just what I'm saying. You take the estrogen and/or progesterone, and it prevents the FSH and LH from growing and releasing. So different methods that this can be. It can be a birth control pill. It can be, is it Depo-Provera? I forget the name for the shot, but a birth control shot. There's even a birth control vaginal ring, which is this that is impregnated with the progesterone and estrogen, and you insert it into the vagina and it stays there for 3 weeks, and then you take it out that fourth week, just like you would take the sugar pills the fourth week for the birth control pills. There's a birth control patch that you put on your skin. Again, you leave it on for 3 weeks and you take it off that fourth week that you're supposed to be in the menstrual stage of the menstrual cycle. And then there's something called an IUD, intra meaning within, and uterus device. So IUDs are, a lot of people are scared of them because back in the day when we first started doing them, we weren't great at them and they caused a lot of problems, but they've gotten fairly safe in the last decade or so. So there's a couple different ones. Some of them are impregnated with the medicine, the estrogen and progesterone, just like all the rest of them. Or this is an option for some women can't take birth control because for whatever reason their body won't let them take these hormones. So there is an IUD that is 100% just copper. It doesn't have any hormones or medicine in it. It's just the copper itself that's spermicidal that kills the sperm. So basically you go into a doctor's office and it's kind of like a ship in a bottle. Y'all ever seen like a ship in a bottle? So these like collapse down and it's inserted into the uterus and then they kind of tug back and it opens up, it kind of deploys. These stay in for a very long time, somewhere between like 5 to 7 years usually. So one of the things they do before they let you have one of these is that they screen you to make sure that you're not wanting kids in the near future. There you go. This one has the progesterone. This one is just copper. Oh God, 7 to 12 years back. Usually they're not going to last this long. I know a lot of patients and stuff that have had these, and I swear they always come out. Like I was taking care of a guy one time, and her husband was having a heart attack, and at that moment when she was like going into the cath lab with us for her to be with her husband, her IUD started coming out, and she had to walk downstairs to the emergency department and had them remove it. So, a lot of people love these, but they can go wrong. This is wishful thinking. Oh, yeah. So remember I said that they used to not be great. So they used to very frequently cause pelvic inflammatory disease. So usually that's when you have gonorrhea or chlamydia that spreads all the way up and pisses everything off. But these can damage the inside of the uterus just because there's something there poking it. So back in the day, we didn't size them right. They weren't perfect. And sometimes they would even like puncture, completely go through the uterus and cause all sorts of problems. This risk is much lower now, but it is still there. Okay, so let's talk about guy birth control, guy contraception. So, hey guys, what's the only way to make sure you don't get pregnant or don't get a lady pregnant? That's right, abstinence. Good job. All right, so ladies had their tubes tied. We said it was a tubal ligation when we surgically severed the fallopian tubes. Well, guys surgically sever the vas deferens, and we call it a vasectomy. So vasectomy is where the vas deferens are severed and then either tied or like burned shut. And again, it produces sterility. So just like a woman, they're still going to make the sperm. It's still going to be released, but it just can't get past the roadblock. And so their body will just kind of absorb it. This is permanent. I will say that tubal ligations in women are incredibly permanent. Like there's no coming back from that. There are some instances where a vasectomy can be reversed, but don't count on it. So again, men have to be completely sure that they are done with their baby making days before they choose to go in and have a vasectomy. So it's done through an incision in the scrotum. So basically this is done like outpatient. So tubal ligations for women, major surgery. Like you got to go in, they cut you open. It's a major thing. Vasectomies, you can do in a doctor's office in 30 minutes. So they make an incision in the scrotum. They basically use a little hook to bring out the vas deferens, that 45 centimeter tube that connected the epididymis to the ejaculatory duct. They cut out a little piece and then they sew it up or tie it up, and then they sew the scrotum up or tie it up. So I'm going to show you a real picture. So if you're squeamish, maybe look away. So this is the scrotal sac in a man. This is the incision that they've made. And this is the big hook tool that they fished out the vas deferens with. So you're looking at the vas deferens right here. So they would just snip that and either cauterize it, burn it shut, or sew it shut. And then sew up this little incision. The guy would sit on the ice pack for an hour and they'd send him home. So barrier methods, where we talked about that women have like diaphragms and cervical cups and cervical sponges. pretty much only one for a man is condoms. I put a link to this contraceptive TED Talk in your link document. It's pretty cool. I really like that TED Talk, so go check it out if you're bored. You're bored. I know you are. So usually we do group projects where everyone, or in small groups, you're assigned an STD to investigate and make a report on and teach your fellow classmates. And I show you one to show you what I'm thinking of here. So I'm gonna present, I believe it is, yeah, gonorrhea to you. Just so you know, chlamydia and gonorrhea are incredibly common, especially chlamydia. And a lot of people don't show symptoms. So we'll talk about that in just a second. Anything that starts with an H, you have for life. So herpes, you cannot get rid of. HIV, you cannot get rid of. And genital warts are caused by, remember that warts are caused by the HPV virus. So that's still H, you cannot get rid of. Syphilis is bacterial and used to be super common and would drive people insane. Literally, like a lot of people that went psycho in the past that are famous, we found out that it's because they had syphilis. And then trichomonas, again, more common than people realize. So I highly encourage you to look into all of these, but I'm just going to tell you about gonorrhea. So gonorrhea is a bacterial infection. The symptoms in males are usually urinary meatus type of symptoms. So pain to pee, yellow discharge from the penis. This is the discharge from the penis. Here's the scary thing in females, it doesn't usually present with any symptoms. They can have it for years and not know. If they are going to have symptoms, a lot of times they think that they have a real mild UTI or a real mild yeast infection. So it burns to pee a little bit. They have a little bit of discharge, but can't really it's not bad enough to take them to a doctor. I will say that these are the symptoms in gonorrhea, right? Sometimes gonorrhea is called the drip for this reason. If we were to talk about chlamydia, it's the exact opposite in that chlamydia usually doesn't have any symptoms in males. So they can have it for years and be giving it to every female they have intercourse with and not know they're doing it. And females tend to present with the symptoms in chlamydia. Gonorrhea, if it's gone untreated, in women it will cause the PID. In a man, it would cause epididymitis, sorry. But a lot of times it does not go untreated in men because they present with symptoms and so they'll go get treated. So it's more likely to cause PID, whereas chlamydia that doesn't show up in men will a lot of times cause that epididymitis because they won't go get it treated. Infertility, again, because of the PID, and ectopic pregnancy, again, because of the PID in females. So treatments are both gonorrhea and chlamydia. I will say if you go to the doctor, they're super easy to treat up front. Once it's progressed to this point, it gets a little more complicated, but it's bacterial. So they just give you some antibiotics. That's it, guys. We're done. It has been an honor and a pleasure to teach you, and I'm going to cry, and I'm going to miss you. And please keep in touch. Okay, bye.